Hello again, I am Julie Hiller and I'm going to do the second portion of my food and cultural fact sheet on the Somali population. In the first presentation, I covered these four objectives. The fifth one here that we're going to cover is discussing nutritional concerns and factors to consider when counseling Somali patients. Nutritional concerns that we want to address are they fry a lot, they use a large amount of oils and ghee when preparing their meals. They use them in preparing their vegetables and meats. In fact, frying is the most common method of cooking. We should be concerned about what cuts of beef and lamb they may be using because a lot of these are high in saturated fats. They have, as pointed out previously, a low consumption of fruit and vegetables. Their snacks often include cakes and donuts, and these, as we know, can be high in sugar and could be high in fat. They add large amounts of sugar to their tea or coffee, and drinking up to 5 to 6 cups of sweetened tea per day is the norm for many Somalis. So this, as you can see, is a lot of extra sugar. They have excessive fruit juice consumption. They're drinking sodas such as Pepsi, and that also the red sweetened drink that I mentioned before, Vitmo. And there's just a low overall concern for eating healthier foods. As mentioned before, they are focused more on the food being halal. A lot of the foods they consume are high in fat and carbohydrates. Some examples of these include malawa, chapati, roti shanai, and halwa. Some high-fat foods are sambusa, burkaki, and makhumri. More focus should be placed on eating high-fiber foods and those that are higher in protein. Examples of high-fiber foods include ambola, ful, iskudarkaris, and sour. And some examples of high-protein foods include foods that have a meat sauce with curry, sudkar, or kebab. Topics that we want to address with the Somali patient is we want to focus on getting them to increase their fruit and vegetable consumption to at least 5 servings per day. We want them to also choose leaner cuts of meat, such as chicken. We can help them to pick leaner cuts of beef or lamb. We need to teach them how to prepare foods differently. As I mentioned before, they use large amounts of oils and ghees in preparing their vegetables or meats, and we need to encourage them and teach them to roast them, steam them, and grill the meats. We want to reduce soda intake, as we know this has large amounts of sugar, and we want to increase their intake of water. We want to teach them to replace sugary snacks with healthier ones. Some examples could be veggies with hummus, apples with peanut butter, low-fat cheese stick, or yogurt. In suggesting these snacks, not only are they getting some healthier fats, but they're getting part of that 5 servings a day of fruits and vegetables. We want to talk to them about reducing or stop adding sugar to their coffee or tea. This would be a big change for many of them, so maybe start by reducing would be a good place to begin. We want to inform them they need to choose low-fat cheese and dairy, and want to discuss with them the reasons why they're using Pediasure. Is it necessary? Do they need to gain weight? Or could it be replaced with a more nutrient-dense meal? And lastly, we want to talk with them about physical activity and ensuring that physical activity is part of their daily routine and incorporating that into there somehow. There are some cultural components that we need to consider in counseling the Somali patient. Many Somalis want their children to be fat. It's seen as being healthy. So we need to keep that in mind. Abdominal obesity is considered acceptable where there are a lot of health risks related to abdominal obesity. Breastfeeding women believe that tea increases their milk production. And we, as mentioned several times, that their tea is heavily sweetened with sugar. There's a lot of importance placed on celebratory foods that are served during their religious holidays, and these foods are high in fat and sugar. So just another component to consider when talking with them. Fasting can have implications for certain health conditions. Medications can only be taken at night. The fasting we need to take into consideration with diabetics. Those that have renal conditions or hypertensive need to keep in mind with medications. And then we just really need to consider the importance that they place on halal foods. We're trying to get them to eat healthier ones, but they do place a large importance on this. Thank you for listening.